Hello, welcome back. The video topic today is constipation in children. How to avoid constipation in children. So first and foremost, all the parents should know, even if the child passes motion 4 to 5 times a day, it could be a constipation, because the definition of constipation need not be always dry, hard, a painful motion or passing less number of days of motion. No, it could be. So people with incomplete evacuation or in a very solid motion, they can pass in lots, small quantities. This is the number one. All the parents should know. Number two, it's constipation is very common in children because of two reasons. One is they're still growing, so physically as well as their intestines. They're all physically and the enzymatic, the digestive enzymes still they are in the maturing stage. So introducing new food, they may not be able to easily digest. So that can lead to constipation or very rarely even loose motion. But constipation is very common in growing children, especially school children. So and third thing, parents should also understand, just because of the child goes to the toilet, they will pass motion. No, they should be given enough time. Suppose the school bus comes, they only 30 minutes before they'll get up and they'll push the child to the toilet and to pass motion immediately. No, this kind of pressurizing them will not work. Maybe what they can do is they can get up, the child can get up a little earlier, at least half an hour, and go and they can spend some time to relax and pass the motion. This is called toilet training. Toilet training is very important. Toilet training is very important, because otherwise the child will, whenever it has a urge to pass motion, they will hold the motion. This is a very wrong thing. So the children should be taught, they should be explained, they should be the language or the way they can understand, they should be told not to hold the motion. Because once they start holding the motion, it becomes a habit and can lead to, in the later stage, constipation, number one. Number two, even holding the motion, they should be taught in a proper way, whether they are in the school or somewhere, outside, they should, once it comes, they should use the toilet. This is very important. And of course, physical activity. The physical activity is also very important, because sedentary life leads to constipation in adult. The same thing goes with children. The children should, physically very active, jump, bending, all these things improve their gut motility and the digestive process, so that can lead to soft stool. Third, water intake. They should have a proper quality of water, so the motion does not become dry. So that helps improvement of the constipation. The other thing is fiber. Fiber, everybody knows, is very important. Roughly we can calculate for every 1000 calories, 15 grams of fiber is very essential. So they should be encouraged to take a lot of vegetables, protein, all colorful vegetables and protein. They have fibers. So whenever they for every 1000 calories, 15 grams of. So according to the age, it goes. Like a teenage people, they may require 30 to 45 grams of fiber. So this is also very important. And very importantly, even in the toilet training, when the child goes to that cell phones, because they take longer time. So the mother, what they do, they don't want to be disturbed, or the father, the parents, they don't want to be disturbed. So they give the cell phone or some video games. They go there, they'll keep on playing. See, the purpose of going to the toilet is to push the motion out. Instead of pushing, they'll be concentrating, they'll be diverted into the phone. So they may take longer. So this is very bad thing. The other one is once they get constipated, the dry motion hurts them. The anal region gets damaged. So fissures happen. So they get pain. Because of the pain, they'll avoid passing motion. So they know, okay, if I get motion, I go to the toilet, when I push, it will burn pain. So what they do is, they start holding it. So these things, you have to go to the doctor, get the child examined whether they have other issues in the anal regions, like rectal prolapse, this kind of fissure, painful one, or even sometimes other rectal problems. All these things they should be knowing. So Constipation in children is very common. Toilet training is very important. Water intake is very important. Physical activity is very important. Fiber intake is very important. And when they go to the toilet, they should not hold it. Whenever they whether the school or somewhere, they should go to the toilet immediately. Make it as a habit. And fiber and vegetables, all these things should be improved. And other medical issues like any tablets causing constipation or fissure causing this problem, all these things should be, the parents, they should look into that. And constipation can cause painful abdomen, bloated abdomen, they may not have proper food, even vomiting, and very seriously it can go for impacted stool, where they will require medical treatment. So laxatives can be given provided the doctor prescribes. Without doctor's advice, prescription, don't ever give laxatives to the child, because if they have internally some other issues, the laxatives can worsen the problem. So laxatives only by doctor's prescription. And of course, the children should be taught why they should pass free motion every day. Otherwise, these are the things can happen, like fissure can happen, piles can happen, rectal prolapse can happen, and can lead to bleeding. All these things they should be taught at the very young age so that they understand and they change. Thank you.